Hi, I'm Dr. Rick Tosti. I'm a hand, wrist, and microvascular surgeon at Rothman Orthopaedics, Professor of Orthopedic Surgery at Thomas Jefferson University, and co-director of the Hand Surgery Fellowship Program. Hand surgery is very complex. No 2 days are the same. One has to be an expert at a lot of different kinds of things. There's an orthopedic component, there's a plastic surgery component, there's a vascular component. So that translates to a lot of different kinds of surgeries, a lot of different types of pathologies. That may include things like fracture care, joint replacements, nerve repair, tendon repair. It may also deal with oncology, removing masses, tendonitis. We've recently started the peripheral nerve program in order to increase access for this type of care. This is the new frontier in hand surgery. It has vast applications, not only just for injuries in the hand, but also for things like stroke and spinal cord injury. We can literally rewire things down in the hand to create a different circuit that goes around the spine. It's really like the joy people have on their face, like when they come back and they're surprised. They're already moving their hand, they're shocked that they're back faster than they thought they could be. They're surprised at how good the scar looks, how small it is, how quick they're back to function, how quick they're back on the mat or on the field. I've dedicated my entire life to hand surgery. It's 98% of what I think about in a day.